Safeguarding prescription drugs in the home where children are present is critical. Using a medication other than as prescribed can potentially lead to a variety of adverse health effects, including overdose and addiction. Dr. Jacqueline Winkelmann of Children's Hospital Orange County explains the dangers of prescribed drugs in the wrong hands.
We have more kids that are dying of prescription over-the-counter drug abuse than heroin, marijuana, cocaine, and ecstasy combined. Our area in Orange County, it actually has been labeled now as an epidemic problem. They're getting them from home. They're getting them from their friends' houses. They're getting them from their family members. 70% of the kids we've interviewed actually said that they can get a hold of these medications within 24 hours, easily. The drugs of choice are usually pain medications, oxycodone, hydrocodone, OxyContin, some of the anti-anxiety medications, Valium, Xanax, and some of the ADD meds, so Concerta and some of those medications. The first thing the parent needs to do is talk to their child. Middle school, I think, is the perfect age. The age range of introduction to these medications is 12, 13 to 15. That's when kids start trying things. But it's also a great age because they're still listening to you versus their friends. How do parents know or suspect that their child may be using some of these medications? It's mostly behavior changes. You'll notice the child that had straight A's that all of a sudden starts dropping their grades. They seem to be more interested in doing things with their friends than their sports or their activities that they used to do. A lot of them will just let them go altogether. And these are some of the signs. You have to be very careful. You have to know where your kid is at all times, and you have to encourage your friends and your family. You have to discuss it with everyone and encourage them to also keep these medications safely.
Dr. Winkelmann tells us of the guidelines currently in place to monitor prescription drugs.
Our hospital noticed a couple of years ago that we had a very high number of teenagers that were admitted to the intensive care unit with prescription over-the-counter drug overdoses. So we started looking at what we could do to help with the problem, because the problem is lack of knowledge and very easy access. So we started an education program with 3 of the nurses on the pediatric floor, started an education program for physicians, nurses, parents, and adolescents. And we rolled that out about a couple of years ago, trying to encourage physicians to prescribe responsibly and to decrease the number of medications the number of pills they prescribe to a maximum of 2 to 3 days with no refills. We encourage them to do that. And we also have a sheet now, which I think is very valuable. We have a sheet on top of each patient's chart who is on a narcotic that actually tells the doctor what they have required for pain medication in the last 24 hours. It's been very successful. We have managed to decrease the pill counts that have been prescribed over the last year and a half significantly, almost more than 50%. And there's been a lot of education done too for every patient and every parent of a child that is going to be discharged with narcotics, and including safekeeping and how to dispose of them and the dangers of having them at home. The parent needs to be in control of this medication. Even if you have an older teenager, you need to be the one dispensing this drug at the right time and the right dosing. It needs to be kept safely. It needs to be locked. And as far as disposing of them, last thing you want to do is flush them down the toilet or keep them. Those are both bad options. What we want to do is we want to crush them. We want to mix them with either coffee grounds or kitty litter or something like that. Put a little water in a bag or in a can and then throw it in the trash. That's the safest way. And we do have some drug take-back days, national days where you can take them to the police department.